Welcome to This Explainer. Today, we're taking a deep dive into the hidden realities and those absolute SOS signs of ovarian tumors, all based on Dr. Yoshi's amazing clinical insights. The human body is just incredibly complex, and sometimes it behaves in ways that are genuinely startling. So, we're going to unpack the whole shebang, from normal anatomy right up to surgical solutions. Let's get right into it.
Okay, so what actually happens when an ovary grows its own teeth? I know, it sounds literally like a medical mystery or some crazy sci-fi movie plot, but today we're exploring exactly how that happens in real life. And more importantly, we're going to see why you should absolutely never ignore severe abdominal or period pain. We've got some wildly fascinating ground to cover.
First step, the basic size of an ovarian tumor. To really grasp the danger these tumors pose, we've got to establish a baseline, right? We need to know what a normal, healthy organ actually looks like before things go south.
The physical shift here is just dramatic. A totally healthy ovary is surprisingly tiny. It's only about the size of the tip of your thumb, roughly 3 centimeters. But when a tumor develops, it balloons up. Once it swells to about 6 or 7 centimeters, well, we've entered a critical danger zone. And why does that matter? Because at that size, this heavy, swollen ovary is at a super high risk of something called torsion. That's where it literally twists in on itself, or worse, it can even rupture.
Now, thinking about a tumor inside an organ can be pretty terrifying and kind of confusing to picture. So Dr. Yoshi uses this brilliant, everyday analogy comparing it to an umeboshi, a Japanese pickled plum, and an orange. Picture this. The tumor is the hard seed of that plum, or the juicy fruit inside an orange. As this tumor grows, what happens to the normal, healthy ovarian tissue? Well, it doesn't just vanish. Instead, it gets stretched super tight around the outside of the tumor. It acts exactly like the thin skin or the peel of the orange. So the bigger the tumor gets, the thinner and wider that healthy outer peel is stretched. This brings us to methods for surgery that actually leave the ovary intact. Getting that orange peel concept is a real game changer because it totally demystifies how surgeons can fix this. And this is incredibly vital news for younger women who want to preserve their natural hormones and future fertility. So instead of just taking out the whole organ, surgeons carefully cut into that stretched outer peel. Then they literally scoop out the tumor fruit from the inside. As they pull the tumor away, they'll find these tiny white blood vessels, which they carefully cauterize or burn just to stop any bleeding. Finally, they stitch that healthy hormone-producing outer tissue right back together. It is delicate, but it's a highly effective way to actually save the ovary. But there's a catch. That amazing fertility-preserving surgery, it's mostly reserved for benign tumors. Generally, tumors fall into 3 buckets: benign, borderline malignant, and malignant. While benign ones can be scooped out using that orange peel method we just talked about, borderline and fully malignant tumors need a way more aggressive approach. Gynecologists treat that middle borderline group basically like cancer. And unfortunately, that often means removing the entire ovary, and sometimes even the uterus, to stop the disease from spreading. All right, let's talk about teratomas and the severe pain that can suddenly strike women in their 20s. This is one of the absolute most shocking types of benign tumors out there. We're talking about the specific kind of tumor that sends young women rushing to the ER in the dead of night, just in sheer sudden agony. To explain how this even happens, Dr. Yoshi gives us this really fascinating perspective. He says, and I quote, "The ovary is a factory to create human life. When it loses control, the employees go rogue." Think about it for a second. The ovary's main job is to provide the building blocks for a human baby, right? So it contains the cellular instructions to make literally anything. If the internal controls of this biological factory break down, well, those cells just go rogue and start producing random body parts all on their own. Clinically, this is known as a mature cystic teratoma. And get this bizarre tumor can actually grow human hair, bone, and fully formed teeth right inside the ovary. I know, no way, right? But it's a very real thing. Because teeth and bone are so heavy and dense, the ovary swells up and becomes super prone to that dangerous twisting or torsion we talked about earlier. When it twists, it cuts off the blood supply and boom, excruciating pain that means you need emergency surgery right then and there. Now, on to endometriosis and the risk of it turning malignant. Teratomas are visually shocking for sure, and they cause these sudden emergencies. But there's another super common condition tied directly to severe period pain, and it poses a much more hidden, long-term danger to your health.
It's called endometriosis. Basically, the tissue that's supposed to line the inside of the uterus starts growing inside the ovary instead. Normally, this lining acts as a bed for a fertilized egg, and if that doesn't happen, it sheds during your period. But when it's trapped inside the ovary, that means every single month the ovary is bleeding internally. With nowhere for that blood to go, the ovary just expands like a balloon, steadily swelling right up to that dangerous 6 or 7 centimeter mark and causing absolutely crippling pain.
When these tumors hit that surgical danger zone, patients are faced with some incredibly tough choices. It's a really stark balancing act. On one hand, if you choose to keep the ovary to save your fertility and those essential female hormones, you're living with the ongoing risk of torsion, rupture, or even the tumor turning malignant down the line. But on the flip side, removing the ovary completely knocks out the tumor and stops the cancer risk in its tracks. The downside? It triggers early menopause and a massive sudden drop in hormones if your other ovary isn't fully stepping up to the plate.
Because chronic conditions like endometriosis can eventually turn into cancer if they're left unchecked for years, I want to leave you with this really vital question. Have you been ignoring your body's SOS signs? Are you just toughing out severe, debilitating period pain with painkillers? Or is it finally time to listen to what your body is desperately trying to tell you? Please don't ignore the pain. It could be exactly the early warning sign you need to take action. Thanks so much for joining us for this explainer, and keep listening to your body.